Celebrate this amazing accomplishment. A law that will change the lives of millions, that will reduce their health care costs, improve their care, address racial equity by making health care more accessible to so many. And we would not have this bill if it wasn't for the members of Congress standing behind me, Peter Welch, Lauren Underwood, and Congresswoman Wilde, who each of them have done so much to be personal champions, to invest their own time, to make a difference. And it's an honor to be with them here today. We're also joined by a number of groups who've also been the backbone of the outside advocacy, and even more importantly, by some of the storytellers, some of the people directly benefiting from these programs who have taken their own time to talk publicly, to talk to their neighbors, to be sure that people understand what this is all about and how important it is. I'm looking for our first speaker, and so we'll move quickly to that when she arrives. But it is, worth noting that this bill is the product and only exists because of the Democrats in Congress, and particularly the Democrats in the House, who have been at the forefront of this, who passed H.R. 3, who in 2006, the Speaker made a pledge to have Medicare be able to negotiate for drug prices, and it has been delivered today. So Democrats have delivered. That's one important thing to know. And the other important thing to remember is that every single Republican voted no. Given ample opportunities to do the right thing, they stood with pharma and against patients. Given the ample opportunity to do the right thing, they did the wrong thing. And that is a very important story for us all to remember. Let me say something about our next speaker, and then I'm going to turn it over to my colleague Brad Woodhouse to do the formal introduction when she arrives. She has arrived. So let me just say that, I think we all know here who the guts, the energy, the determination, who brought that all to the table every day, every year, whether it was on these issues, whether it was in a meeting with the President of the United States, a meeting with their colleagues, or speaking to the public. I mean, we would not have had the Affordable Care Act if it wasn't for Speaker Pelosi. We would not have had the Inflation Reduction Act if it wasn't for Speaker Pelosi. And we would not have protected the Affordable Care Act during 4 years of the Trump administration without Speaker Pelosi. And I just want to now turn it over to Brad Woodhouse, my colleague, the Executive Director of Protect Our Care, to do the formal introduction.
Woo! All right! Who's here to celebrate some health care? All right, my name is Brad Woodhouse. I'm the Executive Director of Protect Our Care. Speaker Pelosi, can you come up here? I want to take just one moment of personal privilege, because I won't get an opportunity to do this much. I am, as everybody can tell, getting old. So I may not get the opportunity to do this again. Before I introduce her more formally, I want to talk about the woman that I met in 2005 who has led the Democratic effort to preserve progressive economics and health care for the American people. She stopped the privatization of Social Security. She won the House in 2006. She shepherded the Affordable Care Act in 2010. She passed the Recovery Act in 2009. She took the House again in 2018 on the issue of health care. She has passed the most progressive and historic legislation in the history of America. I could list it all. But just in the last few years, the American Rescue Plan, the Bipartisan Infrastructure Bill, CHIPS, and what we're talking about today, the Inflation Reduction Act. Nancy Pelosi is the greatest speaker in American history, and she has done more to deliver affordable health care for Americans than anyone who has ever served in any capacity in this country. And with that, I want to turn it over to Speaker Extraordinaire Nancy Pelosi.
Thank you very much, Brad. What he is giving you is an agenda of what we did working together. I'm glad to be here with my colleagues, Peter Welch, Lauren Underwood, Susan Wilde. Susie Lee of Nevada, and others will be coming in the course of the press conference. And this is something that I accept every compliment extended to me on behalf of the House Democrats for their courage to get the job done. But all of our inside maneuvering would not have added up to the success that Brad described without the outside mobilization, without the groups that are gathered here, without the storytellers telling their story. Yes, when we won the House in '06, it was because we went after the attempt by the Republicans to privatize Social Security. It made a difference in people's lives. They knew it. We won. And then we were able to go forward to pass the Affordable Care Act. And when it was under assault later, we were able to prevail to save it because of the storytellers. 10,000 events around the country of people telling their stories, not about provisions in the bill, but what it meant in their lives, their health, the health of their families, and saving their lives. So we've all done this working together. So I accept your kind remarks on behalf of the mobilization that made it possible, the courage of my members to vote for some of the legislation that was mischaracterized in their district. But here we are today to celebrate lower drug prices, better health care. Let me just say this. We've been working for a long time, Brad can attest, and thank you, Leslie, for your leadership. Wonderful to be with you this morning. And Leslie can attest to this as well. We've been trying for decades to enable the Secretary to negotiate for lower drug prices. This is a kitchen table issue. It is something that is of value to us, and we finally were successful in this legislation. We want to do more, but we have kicked open that door. And when we did, to get lower drug prices, negotiate for lower prices, and have the $2,000 cap so important to our seniors, guess what? You can applaud that. Guess what Pharma said? Democrats are going to pay for this. Oh, really? Oh, really? Thank you for that challenge, because we are taking our message to the American people, and we can only do it with our outside mobilization. So I thank everyone who is here for what they have done, what they will do. Let me say about Brad, he's a force of nature. When he talks about the things we did, he's talking about many of the things he instigated, right, Leslie? You too. And Protect Our Care and all of the other the groups that are part of that mobilization, thank you. Thank you. Outside mobilization makes all the difference in the lives of American people. And if I just may say, extending the subsidies was a big fight for us. And because of all of you, we were able to win that fight for 3 more years, which is really a remarkable thing. So it's not just about the lower prescription drug price, it's about the lower cost of health care to families. We promised we would do it. We lowered cost. We only could do it with you. Let me add one last thing, and that, did I say that already? Did I say this? Preserving the planet is a health care issue too. Environmental justice, clean air, clean water, this is all very, very important. So again, we made history with that part of the bill as well, as we contribute to lowering inflation, reducing the deficit, and again, helping families meet their needs. Lower cost, bigger paychecks, safer communities in every way. Thank you all for what you do, and now I'm pleased to yield. Am I yielding? Yielding back to Brad? To Leslie. Let's hear for Leslie. He has been so remarkable. So very remarkable. Thank you, Leslie. Over the years, I was honored to be here with you today. Okay, folks, here's Leslie.
Thank you. Thank you again, Madam Speaker, for all that you do. Every day you inspire us and you deliver. It's fitting that our next speaker, Dr. Jessica Ice, is one of the storytellers, one of the citizen advocates that the speaker spoke about, a person who's taken her own time to share her story, both in political settings and media sections and with her neighbors. So let me turn this over to Dr. Ice in order to tell us about her personal experience with healthcare and why these bills matter in her life.
Thank you so much. I'm so excited to be here, and thank you to everybody who voted for this historic legislation. My name is Jessie Ice. I'm the director of West Virginians for Affordable Health Care. So I'm both a professional advocate and a consumer health storyteller. For me, I'm a single mom with 2 children, Lucille and Byrne. They asked me to say their names. And you know, for us and for so many West Virginians, so many Americans, passage of the Inflation Reduction Act is a game changer. It's a historic and significant legislative package that makes health coverage and prescription drugs more affordable for millions of Americans. In my home, it means saving more than $200 a month on my health insurance premiums and not having to make the choice between health care and family expenses. I can help my son with his flute in the school band, and I can help my daughter access art supplies to fuel her passion. This is money that I can use every month toward food, towards utilities, and quite literally all of the other healthcare costs that we incur. In West Virginia, my state, the Inflation Reduction Act means that more than 20,000 residents who depended on the American Rescue Plan's premium tax credits will see these savings continue. Families buying health insurance on the marketplace in my state will save an average of almost $3,000 a year. For older West Virginians, this is going to be an even higher number. The Inflation Reduction Act will also lower prescription drug costs by giving Medicare the power to negotiate prices and forces drug companies to give back money when prices rise faster than inflation. 49% of my fellow West Virginians who report being in fair or poor health are skipping needed medications. And often this is with life-threatening consequences. You know, with the constant headlines of ever-rising high-priced prescription drugs and unaffordable premiums, it is not surprising that the voters of both parties have really been ready for Congress to pass legislation to curb healthcare costs. And this act, another great thing about it, it's going to save Medicare hundreds of billions of dollars. The Inflation Reduction Act really is a victory for the people of West Virginia and across the nation and my family that will make healthcare more affordable, accessible, and equitable for all Americans. Thank you.
Thank you. And as you can imagine, given where Dr. Rice lives, her voice was particularly helpful and important over the last several months. Let me now turn the microphone over to our next speaker, to Majority Leader Hoyer, who also has been a champion of healthcare every day since he's walked through the halls of this building, and who has been part of the leadership team, both personally and behind the scenes, that has delivered every single step forward in legislation in healthcare since the day he walked into office. We all owe him an incredible amount of thanks, and we look forward, of course, to continuing to work together. Thank you.
Thank you very much, Leslie. If you have your health, you have everything. If you don't have your health, no matter how wealthy you may be or otherwise fortunate you may be, you're hurting. And if you don't have access to affordable quality health care, and Nancy Pelosi, thank you very much. I think she's may have left, but thank her for her leadership on adopting the affordable health care when President Obama signed that bill. We have taken action. I was a little late, Leslie, because I had a TV interview, and one of the things, of course, was about inflation. Inflation is hurting our people. We need to respond to the costs that they're incurring. Lower drug prices, better health care. That's what we did. We capped insulin costs, unfortunately just for Medicare. Why just for Medicare? Because the Republicans would not support the bill that we sent to them, which had capping insulin costs for everybody. So we have work to do in making sure that that care is so essential for everybody. Every American cares about health care. And very frankly, to the extent that we're covered by insurance, each person's cost will go down. We know that. It's an economic matter. I want to congratulate Lauren Underwood because 13 million people would have lost their health care if we hadn't passed the Inflation Reduction Act. It was Lauren Underwood that said we need to make sure in the rescue plan that we dealt with those who were between the Medicaid eligibility and the cost that they could afford under the Affordable Care Act. 13 million people were saved from losing insurance, and every Republican voted against that bill. I want to thank these advocates who are here. These young people are holding up signs. These young people are saying, we thank you for acting on our behalf, on the People's Act, putting people before politics. Very frankly, I heard the minority leader, the Republican leader, give a debate about why we should not be for this bill. He must have mentioned 17 times or more that the election was coming up in 87 days. I think it was 87 days at that point in time. As if that were the issue, as opposed to the people who needed our help. That's why we capped insulin prices. That's why we brought healthcare costs down. That's why we said, let's negotiate. The Veterans Administration has been negotiating prices for years. This is not a new and radical effort. This is an effort to say to my constituent when they come up to me and say, my sister in Toronto pays 1/3 of the cost for the drug that they're taking. How can you explain that? I'll wait till the siren goes by. That's a fire truck, not an ambulance, but it could be an ambulance. And we don't want that person to get to the hospital and say, I don't have any insurance. Now the hospital will treat them, will deal with them because we made that by law. But I am so pleased to be here, Leslie, with you and all those who support this effort to make sure that Americans' prices come down. We're going to beat inflation. We're going to make sure health care is available, working together. God bless you. Thank you very much.
Leader Hoyer's a true leader, and we thank him for all that he does every day. Healthcare is the kitchen table issue in America. It affects everyone equally, no matter where they live, or the kind of work they do, or the color of their skin. And we owe it to all of them to give them this basic, essential right going forward. The leader mentioned events that are happening a few weeks from now. And let's not forget what's at stake, because we know that Leader McCarthy intends to overturn, repeal, get rid of the Inflation Reduction Act. He wants to take the side of Big Pharma over the side of the American people. Many of them want to repeal the Affordable Care Act. Many of them want to sunset Medicare and Social Security. So there is a lot at stake, and there's a clear distinction on their policy positions. Let me now turn this over to Congressman Peter Welch, who is helped lead the effort on prescription drugs. Congressman.
Thank you very much. I'm going to ask a question. How is it that something that costs $10 to make, insulin, is sold for $300? Outrageous. And I'll tell you, there's two reasons why that was allowed to happen. Governmental inaction that was bought, financed, paid for by pharma with campaign contributions, with bogus research, with denial, with fear. That's one. The second is that we have not had a government that has been willing to protect consumers through price negotiation. And folks, we are the only government in this world that won't protect its citizens against price gouging. Now, pharma sings a sob song that if we have price negotiation, they're not going to be able to create new drugs. By the way, do they point out that millions and millions, billions of dollars in taxpayer money goes into research that provides the foundational intellectual property by which we create these drugs? Drugs are good. We need life-saving, pain-relieving medications. But taxpayers are financing that. Pharma companies haven't acknowledged that they have a market that's created by Medicare and Medicaid. Thank goodness through that you can get some access. And employers who are providing health care to the employees they trust, value, and want to be healthy. And all of us, taxpayers and employers who are providing health care, are getting hammered with these ever-escalating premiums. And does pharma mention that there's actually a provision in law that we're now attacking that says they can charge whatever they want? The Medicare Part D included a provision that said there'll be, quote, non-interference. Let me translate that. There will be rip-offs. And pharma is accusing the government of price setting. You know what? They're right. Except they're wrong on who's doing the price setting. It's pharma. And you know what? Those days are over. Those days are over. And the other thing that pharma did, in addition to buying a Congress that held us hostage and kept us from doing what our job was for 16 years, the other thing is that they've preyed on the insecurity and the love that we have for people in our family who need medication. And you know what? Anybody who then needs it, your son, your daughter, your loved one needs it, whatever the price is, you'll pay. You need a second mortgage, you'll pay. That's what happens. Those days are over with this price negotiation bill. And let me say to pharma, we have only begun to stop the ripoff. Thank you.
Thank you. I'd like to now introduce Donna Marie Woodson from the great state of North Carolina, who will tell us her story about how the ACA impacted her life, and like me, now a Medicare beneficiary who will benefit from the Inflation Reduction Act. Donna Marie?
Woo! Ooh, thank you all so very much. It's very exciting to be here today. As a two-time cancer survivor, colon and breast, and the two were not related to one another, on Medicare, married to a type 1 diabetic, also on Medicare. The Inflation Reduction Act is a godsend. Millions of seniors across the country will benefit by the lowering of costs and more accessibility to health care. And I think that this piece of legislation is the greatest health care bill since the Affordable Care Act. And the Affordable Care Act saved my life, so I think that means a lot. Cancer medications and the cost of insulin are crazy, ridiculously expensive. And Medicare being able to negotiate prices, lowering costs for prescription drugs is so vital to my family and millions of families across the country. Capping insulin at $35 a month will save thousands and thousands of dollars for Americans with health care costs. And thanks to Speaker Pelosi, she's not here right now, but thanks to Speaker Pelosi and the House Democrats, the Inflation Reduction Act makes sure that seniors like myself and across the United States don't have to make the choice between rationing a life-saving medication like insulin or worrying about paying bills during cancer treatment. I thank you all. Thank you so much for this, and onward and upward.
Now let me turn the microphone over to Congresswoman Susie Lee from the great city of Las Vegas to give her comments this morning.
Thank you. It is really an honor to be here with Protect Our Care, with all of these incredible advocates who have stood up time and again to make sure that Congress does its job, lowers drug prices, and gives Americans better health care. I'm about to come up on my 56th birthday, and it's an important year because that's the year my father lost his job. And he and my mom both had high blood pressure, and as a result, they were unable to afford health insurance. And 1 month before my mother qualified for Medicare, she suffered a major heart attack. And the hospital charged them and came after their home. And they almost lost their home as a result of that. And I lived that story, and that's why I'm so passionate about making sure that as a member of Congress, I fight every single day, because we all share a story like that. We all share a story like Donna Marie, like Dr. Ice. We all share a story of someone in our family rationing or cutting their prescription drugs because they can't afford it, or not paying their rent because they have to buy prescription drugs. But that's ending now, at least for Medicare recipients, because with the Inflation Reduction Act, we have finally held Big Pharma accountable. We've been promising this. Congress has been fighting for decades to make sure that Medicare can negotiate prescription drug prices. But not only that, we cap the out-of-pocket expense at $2,000 per year and insulin at $35 per month. And it is because of your advocacy that we were able to get this across the finish line. I stand here today with my colleagues, Lauren Underwood and Susan Wilde. We were part of the history-making class of 2018. And we all got elected in answer to Republicans trying to repeal the Affordable Care Act time and time again. But millions of Americans stood up and said, hell no. And they elected us to come to Congress so that we can deliver. And 3.5 years later, not only did we protect it, we expanded it to 3 million Americans, including 100,000 Nevadans who will now see their health care costs reduced by over $2,000 a year. But we didn't stop there. We continued and delivered on our promise to finally hold Big Pharma accountable, and not one Republican stood with us. But not only that, we're going to continue fighting, because we know that what we achieved for Medicare recipients should be available to every American. So Democrats, remember this. We know that American families are hurting with inflation, but time and again, we have delivered. We delivered the Inflation Reduction Act, and we're going to continue to fight. And not one Republican was with us. But that's okay, because we know what's at stake, and we know that we will continue to fight. We will continue to put people over politics. Thank you.
Thank you, and thank you for sharing your story that unfortunately is far too common across the United States. And I think it was a great reminder that in 3.5 years, what the class of 2018 has already accomplished and how much more these leaders will do. So let me turn it over to another leader of the class of 2018, Congresswoman Lauren Underwood.
Good morning. Thank you, Leslie. Thank you all for joining us today. I am honored to join Speaker Pelosi, Leader Hoyer, my colleagues in the Congress, including Susan Wilde, and Protect Our Care to celebrate the historic healthcare wins in the Inflation Reduction Act. Today is one of my favorite days in Congress because today is a healthcare day. Since my very first day in Congress, my mission has been to make high-quality healthcare available and accessible for all Americans. It's why I wrote legislation to lower healthcare costs for families by expanding advanced premium tax credits, which we made law in the American Rescue Plan. Because of my legislation, a record 14.5 million Americans have enrolled in coverage for this year, and 4 out of 5 people can find a plan for $10 or less per month. These are historic advances in coverage, cost savings, and equity. But these provisions were set to expire at the end of this year, leaving more than 15,000 families in my community facing unacceptable premium increases for their 2023 healthcare coverage. My colleagues and I were not going to let that happen on our watch, so we fought hard to get them included in the Inflation Reduction Act, which extends these credits till 2025. These tax credits will make healthcare more accessible and affordable for 13 million Americans and help families of 4 save an average of $2,400 per year. As one of just a few nurses in Congress, I am proud to carry the lessons I learned in my clinical education with me every day in the work that I do. My nursing education has grounded me in an evidence-based approach that centers patients and the communities that are affected by the legislation I write, the votes I take, and the issues I champion, especially in my work to ensure every American has access to high-quality, affordable health care they need and deserve. Simply put, the Inflation Reduction Act is life-changing. A mother from my community was laid off during the pandemic, leaving her family with a hard decision to make: pay the mortgage and keep a roof over their head, or go without health coverage until she could find a new job. That's a choice that no mother should make. Because of my legislation, though, that family's health care coverage, their premiums went from $2,000 a month to $244 per month. That's the kind of impact that we're celebrating today and every day, and it's made possible by the Inflation Reduction Act. I am so proud to stand here with my Democratic colleagues who have met the moment and put people over politics and made high-quality health care affordable and accessible for millions of Americans. It's a healthcare day in Congress, everybody, and I am so proud. Thank you so much. And now I'd like to introduce Congresswoman Susan Wilde from the great state of Pennsylvania.
Good morning, everyone. It's good to be with you and to be with my colleagues on this exciting day. And I have to say, my district is Pennsylvania 7. It is a district where the Inflation Reduction Act kept about 17,000 people from seeing their health insurance premiums increase by over 120% next year. Now, as you've heard earlier, the Republicans have this mission that they are going to repeal the Inflation Reduction Act. And what that would mean to those 17,000 people in my district is that they would face a cliff where they could no longer afford their health insurance. Imagine that. A family of 4 under the Inflation Reduction Act, making about $75,000, and by the way, that's about the median income in my district, would save almost $3,000 per year. What a significant savings for working families. And I have to talk about drug prices because it has been my mission since the day I came to Congress to make sure that we get Medicare negotiation of drug prices and drive down the cost of insulin and so many other life-saving drugs. And my mission was driven by the number of people who came up to me when I was running for office for the first time in 2018, who told me their stories of rationing their insulin, of not taking it in accordance with the doctor's orders because they simply couldn't afford it, of people with very, very expensive chemo drugs that they had to take that were literally bankrupting them. And so I came to Congress in 2018 with this mission in mind, and so I'm incredibly excited that we finally got it through in the Inflation Reduction Act. And as you've heard, no longer will Big Pharma be able to rake in huge profits, record profits, by charging Medicare and, by the way, by extension, American taxpayers, you understand that, whatever sky-high prices they desire. If Medicare could have negotiated drug prices in 2020, the cost of prescriptions filled by Medicare in my district alone would have been $50 million lower, just in my district, if Medicare had been able to negotiate in 2020. And as soon as January 1st, seniors are no longer going to have to ration their insulin because of its outrageous expense. And boy, we still do have work to be done because that's got to be extended to people who are not Medicare eligible. So many of those people that I spoke of before who came up to me in 2018 were actually parents of kids with juvenile diabetes. And this doesn't yet affect them, and we've got to continue to work on that. But thanks to the Inflation Reduction Act, tens of thousands of Pennsylvanians who are on Medicare will finally have affordable insulin capped at $35 a month, and it is about time. We are also, as you've heard, capping out-of-pocket costs, prescription costs at $2,000 per year for Medicare beneficiaries. And for some of the folks who are younger and maybe aren't on a lot of prescription drugs, you're thinking $2,000 a year sounds like a lot. Well, let me tell you how many families I have heard from who are paying far more than that per month for medications. No longer are these seniors going to be burdened with worry about how to pay for prohibitively expensive medication. Thousands of people in my district had their out-of-pocket costs higher than $2,000 in 2020, and they would have saved collectively $15 million in reduced premiums and out-of-pocket costs. And again, that's just in my district. We're saving millions of dollars for taxpayers, and we're making health care more affordable and accessible, and that's real, and it's critically important. It's an incredible victory to have passed the Inflation Reduction Act. We lower premiums. We give Medicare the power to negotiate, and we're not stopping with what we've gotten so far, as my colleagues have said. There's so much more to be done in that area, and we will continue to do it. When Democrats keep the House majority, we will continue to work on this issue relentlessly. Big Pharma is not our friend, meaning Democrats in Congress. They're coming after us. They're not happy, and there's a reason for that. But think about that. As my colleague Peter Welch said, so much of Big Pharma's research is actually funded by taxpayer dollars, but Big Pharma will come after us with commercials talking about how they're not going to be able to afford research and development of new drugs because they now have to negotiate with Medicare. Hogwash. Let me say on that issue that what they spend on marketing and on lobbying Congress is far more than they spend out of pocket on research and development. Don't ever let them tell you otherwise. But our work isn't done. I'm so happy to be partnering with some of my wonderful colleagues in Congress, and most of all with the outspoken advocates who are here today. Groups like Protect Our Care. It's been a delight to work with you over these last several years. And it's good to know that none of us are alone in this mission to fight higher healthcare costs. Thank you.
Thank you. Thank you.
I asked some of our colleagues here from Washington to join me. Emily G. from CAP, and Richard Fiesta from the Association of Retired Americans, and David Mitchell. I also just want to recognize some of the other groups that I hope are still here with us today. AARP, who's done an absolutely amazing job rallying their troops and making the case. Our friends in labor, AFT and AFSCME. Patients for Affordable Drugs, who've made an incredible difference. Network Lobby, Little Lobbyist, Moms Rising, and of course my colleagues at Protect Our Care, who I look forward to working every day as hard as we can for the American people, and who do a great job. So let me now start with Emily.
Thank you, Leslie. Good morning, everybody. Congratulations to all of you, advocates, and thank you to the members of Congress and the staffers as well, who've worked for years, if not decades, to pass this historic law. I'm proud to be here this morning on behalf of the Center for American Progress, an organization dedicated to improving the lives of all Americans. In pursuit of our mission, we also fight to ensure that everyone has the opportunity to achieve their full health potential. American Progress helped draft the blueprint for the Affordable Care Act, and we also fought alongside all of you to help save it from repeal. And we supported you in building upon the ACA through the Inflation Reduction Act to help get more people covered and stay covered by extending marketplace subsidies through 2025 in the IRA. We know these expanded subsidies are working because the uninsurance rate is now at an all-time low of 8%. These IRA subsidies make health insurance more affordable for 13 million Americans, each saving about $800 every year. The IRA is an incredible victory, not just a victory over special interests and Big Pharma, but also a victory for America's seniors. While everyone deserves access to medications they need to survive, we live in a country that's been paying 2 to 3 times more for drugs than our peer nations. And all too often, people skip doses, ration medications, or leave prescriptions unfilled because of cost. But starting in 3 months, Medicare beneficiaries will have an out-of-pocket, starting 3 months, Medicare beneficiaries will pay no more than $35 per month, thanks to the IRA for insulin. And soon they will have better protection than ever against drug costs because of a new $2,000 out-of-pocket cap. And speaking of seniors, it's now my pleasure to introduce someone who's a tireless advocate for older Americans, Richard Fiesta. Rich, for the past decade, has been the executive director of the Alliance for Retired Americans, leading 4 million members in protecting the health and economic security of older Americans and retirees. He's also a veteran of these Capitol grounds, having served as a staffer both in the House and in the Senate. Welcome, Rich.
Thank you, Emily. And good morning, everyone. I am Rich Fiesta, Alliance for Retired Americans. We're a national grassroots organization of retirees throughout the country. This has been a 20-year fight for us for a very simple common sense idea. Let Medicare, on behalf of 50 million beneficiaries, use its buying power, like the VA does, like the military hospital system does, to get lower drug prices for beneficiaries of Medicare, and that will ripple throughout the economy. You know, we've just heard Americans pay the highest prescription drug prices in the world, and that hasn't happened by accident. It's been 20 years of a law that was literally passed in the middle of the night that has allowed Big Pharma to set prices without any transparency or any bargaining, unlike all of our economic competitors. Well, we've always heard help is on the way, but help is here now, and help will start this coming January 1st. We've heard about insulin, capped now at $35 a month, a drug you can walk into any pharmacy in Canada without a prescription and buy over the counter for about $10. And yet our seniors and children and everyone in between are paying hundreds. January 1st, vaccines under the IRA will be free for the necessary ones. That means the shingle shot, for example, which seniors and others are paying hundreds of dollars for, will be free. The tetanus shot will be free as well. Currently, they're out of pocket. Those are barriers for better health care as well. This has been a long time coming. We've sent our members into Canada to come back and have press conferences on the disparities where they're saving 30 to 90% of drugs. As we've heard, there will be an out-of-pocket cost cap, and we're on our way to negotiation. And also next year, if Big Pharma raises drug prices above the regular rate of inflation, they must, with teeth, start paying rebates to the Medicare system. This is a great thing for not only for taxpayers, but also for our beneficiaries as well. But as we've heard before, we're not done. Insulin's only to Medicare beneficiaries, not to children, for example, or adults under Medicare, who are less than the Medicare age as well. We're still paying exorbitant out-of-pocket costs for drugs, especially that seniors who spend more of their income after a lifetime of work on drugs as well. So we haven't yet stopped, and we're still going to fight for more than what we've had. But this bill is a huge, huge success with the narrowest margins in the House and Senate under great leadership, some of whom we've heard today. And today, I also want to introduce another great leader in this, David Mitchell from Patients for Affordable Drugs. David not only has talked the talk, he has walked the walk in both his organization and his own challenges trying to find affordable drugs, and has spurred him into being a great leader in this fight. David.
Thank you, Richard. That's a bit of hyperbole, but I am glad to be here today, and I'm especially glad for you guys because I'm the caboose. We're almost done. I am the founder of Patients for Affordable Drugs now. I'm very grateful to Speaker Pelosi and Majority Leader Hoyer, the other members who were here, for the incredible job that they did getting this bill through the United States Congress. I have an incurable blood cancer, and prescription drugs are keeping me alive, literally. Right now, my doctors have me on a 4-drug combination that carries a list price of more than $900,000 a year. Now, I'm very grateful for these drugs, but the simple fact is they are wildly overpriced, as are many drugs for cancer, MS, autoimmune diseases, cardiovascular disease, and so many others. But things are about to change. For the very first time, after almost 20 years of fighting, Medicare is going to be required to use its purchasing power to get a better deal and lower prices for Americans on the prescription drugs they need. For the very first time, beginning at the end of this year, there will be curbs on annual drug price increases to limit them to no more than the rate of inflation. For the very first time, there's going to be an annual out-of-pocket cap on what Medicare beneficiaries pay for our drugs. Currently, I pay more than $16,000 annually for just one of my drugs under Medicare Part D, a chemo drug. In 2025, that's going to go down to $2,000 a year, and that's not chicken feed. This sweeping legislation represents a sea change in U.S. drug price policy. It's going to transform lives and save millions of Americans millions of dollars. Americans like Catherine Pepper of Kent, Washington, who lives with both rheumatoid arthritis and diabetes, even with Medicare. She spent almost $15,000 a year just on Humira, a drug whose price has increased by over 400% since 2006. Catherine says the measures to curb drug price increases for Medicare beneficiaries will ensure that Humira's manufacturer, AbbVie, cannot continue to price gouge patients like me. And the $2,000 out-of-pocket cap will allow me to afford my Humira without making sacrifice after sacrifice. As others have said today, there's more work to do to build on this victory. But on behalf of Catherine, myself, and millions of others like us, today we say thank you.
I just want to thank all of our speakers today, everyone who came to listen. I particularly want to thank Dr. Rice and Donna Marie, who made the trip to share their story. Thank all of the hardworking people inside this building and outside who made today a reality, and I know we'll continue this fight in the future. Thank you. Thanks for being here.
Thank you, sir.
Thank you. Thank you.
Yes, no one thanks.
Where are you when you're not here?
I'm done.
Huge issue. Thank you.
One, two. One, two. One, two. One, two. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2.